Hello, I'm Ralph Duckett, urologist with Caldwell Urology in association with UNC Hospitals and Caldwell Memorial Hospital in Lenore, North Carolina. I want to talk to you a little bit today about what's known as BPH, or benign prostatic hyperplasia, which is non-cancerous growth of the prostate. All men, starting as early as their 30s, begin experiencing some enlargement of the prostate, and this is under the influence of the male hormone testosterone. This is a normal part of aging, and the size increase doesn't necessarily linearly correspond to problems. In fact, some men with smaller prostates have more problems than men with large prostates. But the enlargement ultimately is the thing that can cause concerns with urination. These are primarily obstructive symptoms: dribbling urination, start-stop urination, difficulty initiating urination, especially in the morning, and in some cases progress to what we call urinary retention, where you can't urinate and require a catheter. In association with this, there are other symptoms such as frequency, urgency, nighttime urination, or what we call nocturia. And so this is a very, very prominent problem. Treatment ranges from medical to surgical treatment or combinations, but what I want to talk to you today about is a procedure called Urolift. It's a new procedure, minimally invasive. It's now part of the American Urological Association guidelines as first-line therapy. And there are a lot of people who are on dual medication, generally one called Flomax or tamsulosin, one called finasteride. The main name is Proscar. And the goal would be to get patients off of two medications, urinating better, with a minimally invasive procedure that takes about 15 minutes, done in a surgery center under minimal sedation with lidocaine installation in the bladder to help numb. The procedure's done, most patients go home without a catheter. About 1 in 10 go home with a catheter overnight. And then we see over the course of a few weeks the improvement in progress. This is very different from what you may have heard about laser prostatectomy, or TURP, which is the roto-rooting of the prostate. This procedure has very little blood loss, no tissue resection or cutting. And I want to show you a picture that shows the prostate and how this procedure works. So we do this with scopes through the urethra of penis, and then with the numbing we place pledgets that hold the prostate open. So think about the prostate having lobes that are obstructing, and flow through is difficult. But then with the pledgets we hold this back and allow flow through the prostate and urethra to be much more effective. What's nice about this is not having to have general anesthesia, less bleeding. You can be back at work easily within 48 hours as opposed to 1 to 2 weeks. Generally no catheterization. If the procedure is performed, it does not limit us from other procedures if necessary. It doesn't have any impact on treatment for prostate cancer if ever necessary. But then the upside again is potentially being off two medications, not only the cost impact of that, but the difficulty in interaction with other medications. The procedure itself is generally covered by most all insurers, and now it's covered by Blue Cross, which is a significant step. It's covered by all forms of Medicare. And the best thing I can tell you is that there are just a number of patients that now that we're offering this in this area that are very happy, better with their symptoms, emptying better, less retention, and most importantly, off medication. So if you're having problems with BPH, or if you're under current therapy and want to consider other options, I would highly encourage you to consider the Urolift. Information is available online. We'll show that here in just a minute. And then otherwise, feel free to call us at Caldwell Urology, 828-757-6510. If there are questions, concerns, we're happy to help, but more than happy to schedule an appointment and talk to you about your concerns and what options might be available to you. Thank you.